gonadotropins and controlled ovarian stimulation, protocols for ovarian stimulation in IVF and IUI, introduction to ovarian stimulation protocols. Ovarian stimulation is a key step in assisted reproductive techniques, RT, like IVF and IUI. Gonadotropins, FSH, LH, HMG are used to induce multifollicular growth. The choice of protocol depends on patient factors, including age, ovarian reserve, and previous response to stimulation. Goals of controlled ovarian stimulation, COS. For IVF, stimulate multiple follicles to retrieve multiple eggs for fertilization. Prevent premature ovulation using GnRH, agonists or antagonists. Trigger final follicular maturation with HCG or GnRH agonists. For IUI, stimulate 1 to 3 follicles to enhance chances of fertilization while minimizing the risk of multiple pregnancies. Support natural ovulation or trigger ovulation with HCG. 1. Ovarian stimulation protocols for IVF. 1. Conventional IVF stimulation protocols. 1. Long GnRH agonist protocol, long protocol. Most common IVF stimulation protocol. Suppression of natural cycle. GnRH agonist, leuprolide, buserelin, starts in luteal phase, day 21 of the previous cycle. Prevents early LH surge and premature ovulation. Controlled ovarian stimulation, FSH or HMG, starts on cycle day 2 to 3 after confirming ovarian suppression. Dose 150 to 450 international units per day. Follicle monitoring via ultrasound and estradiol levels. Ovulation trigger, HCG 5,000 to 10,000 international units, or GnRH agonist when follicles reach greater than or equal to 18 millimeters. Egg retrieval 34 to 36 hours after trigger. 2. GnRH antagonist protocol, short protocol. Preferred in poor responders, older women, or PCOS patients. FSH or HMG starts on cycle day 2 to 3. GnRH antagonist, ceterorelix, ganirelix, starts on day 5 to 6. Prevents LH surge while reducing stimulation duration. Final maturation trigger, HCG or GnRH agonist. 3. Mild stimulation protocol, mini IVF. Lower gonadotropin doses, 75 to 150 international units per day. Reduced risk of OHSS and multiple pregnancies. Ideal for women with poor ovarian reserve or mild ovarian stimulation. 2 ovarian stimulation protocols for IUI. 1. Natural cycle with trigger injection. No medications given for stimulation. HCG trigger, 5,000 to 10,000 international units, given when follicle size is greater than or equal to 18 millimeters. 2. Clomiphene citrate or letrozole plus gonadotropins. Clomiphene or letrozole given for 5 days, cycle days 3 to 7. FSH injections 50 to 100 IU, added on days 7 to 10 if needed. HCG trigger shot when follicles reach 18 to 22 millimeters. 3. Gonadotropin only stimulation, superovulation. FSH 50 to 150 international unit per day starts on cycle day 2 to 3. Ultrasound monitoring every 2 to 3 days. HCG trigger shot when 1 to 3 follicles reach maturity. IUI performed 24 to 36 hours after HCG injection. Choosing the right protocol. Patient-specific approach. Patient profile. Best protocol. Young, good responders. Conventional IVF, long protocol. Poor ovarian reserve, low AMH, high FSH. Mild stimulation or GnRH antagonist. PCOS, high intrafollicle count, risk of OHSS. GnRH antagonist with low-dose gonadotropins. Unexplained infertility, IUI candidate. Clomiphene/letrozole plus FSH. Recurrent IVF failure, modified or mini IVF. Risk and complications of ovarian stimulation. Ovarian hyperstimulation syndrome, OHSS. Excessive ovarian response leading to fluid accumulation and enlarged ovaries. Risk factors: PCOS, high estradiol levels, excessive follicle response. Prevention: lower gonadotropin doses, GnRH agonist trigger instead of HCG. Cycle cancellation if high risk. Multiple pregnancies, higher risk in IU. High cycles with uncontrolled follicular development. Mitigation: careful dosing and monitoring of follicular response. Poor response seen in older women or low ovarian reserve patients. Solution: adjust gonadotropin dosing or use mild stimulation protocols. Conclusion: ovarian stimulation in IVF and IUI. Gonadotropins play a critical role in controlled ovarian stimulation. IVF protocols include long, short, antagonist, and mild stimulation protocols. IUI protocols range from natural cycles to gonadotropin-only cycles. Individualized treatment selection optimizes success while minimizing risks like OHSS.